to this NSK Ikigai podcast. I'm Siobhan Kelleher, and today we are speaking with the Cambridge Hygienist Amie Holder-Soares about air polishing and air powder therapy in practice. Good morning, Amie, and thank you so much for your time today. Please tell me all about yourself and give us a background. Why did you become a dental hygienist?
Good morning, Siobhan. So I've been a hygienist now for 10 years, qualified. Before I was a hygienist, I was a dental nurse for 5 years. And I kind of got to the point where I loved being a dental nurse, absolutely, thoroughly enjoyed it. But I was getting to the point where I just felt like I needed to be a little bit more hands-on and actually treat the patient myself. And there's only so many fillings and root treatments and extractions and just the general pace of dental nursing. There's only so much of that I felt like I could do, and I was ready to move on to the next challenge, which for me was to be a dental hygienist. So I had a lot of really good support in the dental practice that I was working at in Ripon, and basically they really helped me to apply for the University of Sheffield. So I was accepted and I started in 2010 and qualified in 2012. There weren't many jobs up in Yorkshire, so my best friend Roberta, she asked me if I wanted to come down to Cambridge, and I did, and that's why I'm here today. So I've been living in Cambridge now for 10 years and working here between lots of different practices. So I've kind of moved from many, so I've had a lot of jobs, and I feel quite settled in the positions that I'm in now, purely from the point of view of I have a lot of support from those practices, and I have a dental nurse, and they're just such wonderful teams to be part of.
Oh, that's lovely to hear, isn't it? And Amie, what interests you most about being a dental hygienist?
So for me, it's about educating the patient and seeing the results. So seeing, a periodontal pocket go from an 8 down to a 4, improving the gingival health, seeing a patient who will come in with concerns of bleeding, they're waking up with blood on the pillow, or they're spitting out blood, and actually turning that patient around, sort of full turnaround, so that actually I improve that oral hygiene and the bleeding stops. And some patients will come in, they've said they've had bleeding all their lives, you're not going to stop this. It's just something that I've always had. And actually educating that patient, say, actually, no, that's not normal. We can actually reduce the bleeding and potentially get it to stop. So for me, it's seeing those patients change. So having a positive impact on their oral hygiene.
Excellent. And very interesting. Tell us about the founder of the Cambridge Hygienist.
So I started this in 2019 and 2018, I think it was, just before I had my son. And my idea was to create a platform that patients can contact me personally, because I have a lot of patients who potentially I saw in one practice and they wanted to follow me to the next one. So it was basically a way of them contacting me directly. So that was the first reason. The other reason I started it as well was because I was doing a lot of helping the community at that time, where I would go into schools or go to local scout groups, brownie groups, guide groups, to show them demonstration on oral hygiene and talk about diet as well. So actually getting in there at a younger age just to educate them again, so that we don't have problems later on in the future. And also I would also provide them all with a little toothbrush and toothpaste sample. Yeah. So
the Cambridge Hygienist, are these direct access patients then?
Yes, they are all direct access patients. They can obviously just come and see me without being part of the dental practice as such, so they don't have to see the dentist at that practice. They can come
So
and
they
see me
stay
freely.
under your the Cambridge Hygienist list, if you like. That's your list of patients, or
So I don't really hold a list of patients. It's just a way that they can contact me if, for example,
okay.
I was to move from one practice to another and they wanted to stay with me.
Okay. And what's your thoughts on direct access, and how does it work for you and your patients?
So for me, direct access is brilliant. It came out in 2012, just after I qualified. It just enables my patients to come and see me freely without having to see the dentist. So if they've got a nice rapport with one dentist, and I'm changed from one practice to another, then they can continue to see me without feeling obliged to change dentist. I mean, obviously it is easier if the patient sees the dentist in the same practice, just from the point of view of having a contemporaneous, the notes are all, I can, exactly. But with direct access, it just increases access to dental care, so that patients can just come in. If they're just walking off the street, they can just come and see the hygienist. And it's just to help with prevention as well, prevention of disease, really. So it's just another way that a patient can access the dental system.
Absolutely. And tell us, what kind of equipment do you use to deliver treatments to your patients?
So I use an ultrasonic scaler, and I also use the Profimate Neo alongside the Periomate, depending on what I feel is going to be best for the patient. My Profimate is my go-to for stain removal. So if, for example, a patient comes in and they've got a lot of staining, or not even a lot of staining, just a bit of superficial staining here and there, generally tea, coffee, red wine, staining from diet, then my Profimate will be my go-to.
The Profimate Neo for the stain removal.
Profimate Neo, yeah. So that is the powder, which is brilliant. So
it's a nice powder, isn't it? Because the shape of the powder is spherical, so it kind of rolls off the surfaces, which is quite nice.
Yeah. So obviously that then obviously gives less trauma, and it penetrates all corners, so you can really get into those areas with quite a nice amount of surface area, with the flow from the nozzle, so to speak. But yeah, I mean, I love it, and quite often I'm not in dentistry to make money, but it is a nice added extra to your amount in the day. So you can easily, if you're upselling it, then we upsell it and offer it to our patients.
What treatment do you apply at the end? Do you like a fluoride varnish or a fluoride rinse?
Yeah, a fluoride rinse is very effective straight after.
Or even just that 1450 parts per million toothpaste is quite good to apply afterwards, just because the pellicle layer is gone, I suppose, isn't it?
Yeah, sure, yeah.
So you're seeing great results with your patients then?
Yeah, I see great results, and I have a lot of good feedback as well, which is really important, because obviously you know that you've done a good job, but it's making sure that the patient knows. So I always like to do a before and after photo, always. Obviously if the patient says, oh no, I don't want that doing, it's not necessarily just for social media. It's just so that I've got something hard to show the patient, this is what they look like before and this is what they look like now, and then I send that straight to the patient's notes, because I think if you are offering anything as an additional to what you're doing, it's really important that you can actually show why you're doing it, and the photography is the best way of showing, just from all points of view, legally it's a great way, and so that your patient can see the before and after. And if they're happy for you to pop it on social media, then that's an added extra, isn't it?
Yeah.
You get your consent.
Get the consent forms. So that's the supragingival system. And what about the subgingival system, the Periomate with glycine powder? Have you been using that at all?
Yes, so this is, I don't know if many people know this, but this is actually a different handpiece completely. So you wouldn't necessarily pop your powder, you wouldn't put your powder from this into the other, into the Profumate Neo. So they are different handpieces and they are used for different reasons. So this is, it's a glycine-based powder, which is great for the treatment of periodontal pockets, and absolutely brilliant. And I use this a lot for my patients who have got implants. So it's a great way of just disrupting the biofilm and actually cleaning subgingivally in areas where you probably couldn't effectively get to with your scaler. So it does cover quite a wide surface area. And it's got a fine water spray obviously alongside the powder as well. It's very gentle and it eradicates the biofilm, and it really does avoid injuries to soft tissues. So I've never had any trauma from using this handpiece, from using the Periomate.
I love the Periomate and glycine, and because I've been practicing a long time, obviously a lot of my patients are in maintenance, so I rarely have to pick up the Periomate Neo any longer. So I just reach for the glycine all the time, but the patients absolutely love it. So,
yeah.
And the other thing, I suppose, if we're using glycine, we don't need to be checking to see where those beautiful composites are, do we? Because it's a talc-like powder that's so soft.
So soft, yeah. I mean, and the mouth still feels so lovely and fresh after having it done as well. So you feel like you're giving your patients an added extra for, it's just like a little extra that all my patients love it. They really do like it. And it's so easy to offer it to them. If they've already had it, they're kind of coming in already expecting to have it. So for example, I didn't do it, they would say, oh, where's that powder, watery
they do love it.
Pressure washer. And I was thinking, oh god, I haven't done it.
I suppose for us, Amie, to stress here that this is a maintenance procedure, and we wouldn't ever use this on very inflamed tissue,
of course.
In deep pockets. And even just from using a spray around the gingival margin, it goes to 4 millimeters anyway. So just be careful about going into deep pockets, because we don't know what's happening in those deep pockets. And tell us, how do you persuade your practices to invest in the powder therapy?
So I really didn't need to persuade them at all, actually. One of my practices, they already had it. So it's just making sure that it's maintained well. But my other practice that I started at last year in March, they're so up to date with the latest technologies and the most effective way of treating your patients and patient safety and everything. I just said, look, I use this in pretty much every day of my working life, and I really would like it. And they would say, look, if you're using it all the time, then that's not a problem, we'll order it for you. And it literally arrived the next day. So I knew then that this practice is 100% the practice for me, knowing that I didn't have to beg or be like, oh, please, I really need it, or these are financial gains, or these are the patient gains and all that kind of. I really didn't need to go down that route. However, if I had to, I think it would be quite easy to persuade the practice owner, because for every patient that I see, if I upsell a Profumate Neo treatment, powder therapy treatment, it's an additional £30 on top of their treatment. So if I broke that down to how much, if I do 6 a day, for example, if I break that down, then they will see how quickly you can actually pay the handpiece off. So I think it would be quite easy to persuade. But if anyone's got any, if anyone's struggling to persuade the owner of the practice, then feel free to message. I'll help you.
So, when I first started air polishing years ago, the mess over me, the patient, the room and everything. And sometimes colleagues now say to me, oh no, I can't do that air polishing, because they still think back to those previous years. But now everything's changed because we now know how to control it and use the equipment. So what's your tips and tricks around that? What do you think people are doing wrong, and how are you getting it right now?
Yeah, so I would agree with you. About 10 years ago, I picked up the handpiece and I was using it, and it was just like a snowstorm. It was everywhere, all over the patient's face, in my hair, all over me, everywhere. And to be honest, I put it back down. I was like, no, I haven't got time for this. I haven't got time to clean up. I haven't got time to clean down the patient. So, but when I came back to this after reading how good the treatment is and how effective it is, and actually how quick it is to get a very good result without going over the appointment time, because this is what it's all about. You've got to do it in an effective way to keep your appointments, to keep you running on time, but also deliver the patient's expectation. And I think this is a great way of doing that. But yes, there is so much mess. Nowadays, what I tend to use is I pop my apron on or my gown, and I always make sure that my patient's got their little bib on, and I use an Optrogate. And I think that Optrogate for me was a game changer. And again, the practice that I work at, I said I use Optrogates. Now, Optrogates, they are quite expensive. I think they work out, is that about £1 an Optrogate?
Something like that,
yeah. However, if it just really does allow you to complete your treatment in a messy-free way, because you're actually retracting the soft tissues so that your nurse can actually follow you around without having to retract the lip or think about the cheeks. They can actually just follow you around to minimise the amount of aerosol in the spray. And obviously with a high volume suction, then that's great. If you want to pop a little salivary ejector in the back of the mouth, then you can do that. But I don't feel like I need to do that, to be honest with you. And also just keeping it away from the gingiva as well. And yeah, I think that's
gingival, yeah, definitely.
Yeah.
A little bit of lip balm or something on the lips to keep the lips.
Yeah, of course. Yeah, and another thing I always have on my tray is a little blob of Vaseline with a little cotton wool. My nurse pops that out on every single tray, because especially this time of year, our poor patients are coming in with their chapped lips. They always look really dry. So
yeah, I used to work at a practice and they used to give everybody a little lip balm.
Oh, love that. Yeah.
Yeah, just a little bit of advertising, but I used to think it was lovely, and they used to really nice. It's a really nice idea, isn't it?
Yeah, really nice.
So you'd encourage hygienists and therapists to give powder therapy a trial in practice?
Definitely, absolutely. Try it, practice on your family, practice on your friends, practice on the nurses, reception. Because the nurses and reception are your biggest fans, really. If they like treatment that you do, then they're going to talk about it, and they're going to talk about it to everybody. And just, they just feel a little bit more valued as well, because it is a hard job for them, reception and nursing. It is difficult. And I think if you can just give them that little bit of something, and you're just practicing anyway, because you're going to, that's what your benefit is. I would definitely pick up both hand pieces, definitely.
Amie, it's been fantastic. The best of luck with the rest of your career path, and thank you for taking the time to speak with us today.
Thank you so much. Thank you.
Take care. Bye now.
Thanks. Bye.
Once again, we would like to thank Amie for her time. For more information on NSK products and services, please visit www.mynsk.co.uk. Thank you.